Thanks for staying with us. All right, so let's move on to updates on COVID-19. Report has it that Israel is currently on lockdown. UK, France, and some other developed countries are seriously considering another total lockdown in a bid to prevent the imminent second wave of the pandemic. Now, international flights have opened. Owambe parties have started coming back. And we're thinking, are we also on the verge of getting another wave of COVID-19? Joining us on the show is the National Coordinator of Presidential Task Force on COVID-19, Dr. Sani Aliyu. Good morning, Dr. Sani Aliyu. How are you doing today?
I'm very well, thank you.
Thanks
Good
for
morning.
joining us. All right, so schools started yesterday. The kids are back in school and international flights are open. Most states have drastically reduced testing. Only about, I think, Lagos, FCT, and maybe Port Harcourt or so are still testing. As the coordinator for COVID-19 in Nigeria, in your view, how best do we ensure that we can continue to keep safe, even though testing has stopped across the board?
So I think there are 2 or 3 things that we need to that's really critical if we want to avoid a second wave. The first one is the issue of testing. We cannot define our problem without really looking for it. For a lot of states, as you correctly said, we have a lot of silent states. Silent states as in we have no idea what's going on in those states. They are barely testing at all. And testing is so critical. We continue to work with across the states to make sure that testing is accessible to everybody, it's easy to get, and more importantly, it remains free. So we don't want the public to confuse this issue of paying for international travel with routine testing. No federal lab, no NCDC lab on the network, no state government laboratory is allowed to charge a kobo for testing. We really need to improve our testing. So that's one. Secondly, is the issue of compliance with non-pharmaceutical interventions. And these are basically 3, even though we keep on talking a lot more. But it's basically 1, washing your hands all the time or sanitizing your hands. Secondly, the use of face masks. And thirdly, maintaining physical distancing. And these measures, yes, they might be inconvenient, but they are so critical because now is the time for us to protect our vulnerable population. Our vulnerable groups, such as people above the age of 60, 65, those with diabetes, hypertension, and other comorbidities, they are more at risk now of catching COVID than at any other time in the epidemic. Why? Because all of us have relaxed. People have stopped using face masks. You go to parts of the country and you're just amazed at the level of non-compliance. No face masks in large groups of people. And this is such a risk. We can see what's happening in Europe. We can see what's happening in parts of Southeast Asia. This virus is such a clever virus. It doesn't go away immediately. You need consistent effort in order to get rid of it.
Right.
And the fact is, if you catch COVID now, it can still kill you in the same way that it would have killed you in March or April. And the virulence of the organism hasn't changed. It hasn't changed at all. It's just that we've been quite lucky in this country. We haven't had the sort of deaths that we were all afraid of, partly because of the activities that we put in place.
Right. All right, sir. So there were reports, I think about 2 weeks ago, where people said they were being charged for the testing. And one of the reasons some people are not coming out to test is the fear of the amounts they are going to pay, knowing that the large number of populace do not have that amount of money. Can you give us in clear terms, is there, like, you know, sometimes we hear, for instance, in the public sector, in the hospitals, you go and they say you don't pay for this, but then when you get there, you have to pay for gloves, you have to pay for this. Is it exactly what is happening in this system, or is it when you get there and you present yourself, you are tested for free? Can you just give us, like, you know, a clarity on that?
So yes, thank you. So the only situation where you need to pay for a COVID-19 test is if you're going on international travel. Okay. If you're going on international travel or you're coming into the country from abroad, if the purpose is for the purpose of international travel, you will need to pay. And there's a portal. We have a Nigeria International Travel Portal, NITP. You go onto that portal, you pay for those services, and it gets done If you're coming into the country, you do the test at day 7. If you're leaving the country, it's your responsibility to check with the airlines to see whether it's necessary, because it's not even necessary for every country or every airline. But outside that situation, nobody should pay for a COVID test in Nigeria. It's free. We provide the kits free across the laboratories, particularly the state government laboratories and the NCDC network. And we have a list of these laboratories online. Only private labs can charge, and even the private labs, they are only allowed to charge in the context of international travel. Those private laboratories that are providing a service to the state government pay them for every test that they do. The public are not expected to pay. So we want this confusion. Please let's remove this confusion. It needs to be very clear to the general public. You do not need to worry about paying for a COVID test in Nigeria. Okay. It is free because it's important that we know the stage of the epidemic we are currently in.
Right. How many labs do you have for testing in the whole of Nigeria?
So we have over 80 laboratories. We started off with barely 4. Out of the 80-something laboratories, I think 88 also, about 18 are private laboratories. The majority are government-owned laboratories. Virtually every state except Niger State has a laboratory for testing.
All right, let me ask this question.
Every state in the country.
For those people coming into Nigeria, there was a trending video, I think for the past 1 or 2 weeks, about a woman who was complaining that she was being charged 50,000 or so amount just to take tests coming in from New York, I believe, to Nigeria, after she had already taken a COVID test, which was free in one of the pharmacies in America. So the question is it that high? And she had to pay for herself and her daughter. Has that been adjusted, or is that how expensive it is?
You've even missed the point. Not only, she didn't have a problem paying for the test, but she was supposed to collect the QR code. When she paid for the test, they didn't give her the QR code. Her friend traveled to Dubai and got stuck in Dubai because they didn't give him, after paying that 50,000, he didn't have the QR code to board, and the airline refused to carry him until he had that QR code.
So yes, so at the beginning there were challenges with the portal. Just like with any other internet service, if you start providing it at the beginning, it gets overwhelmed. But I'm very pleased to say that the portal is working now very well. It's working very well. When it comes to the QR code, you can actually generate the QR code without even paying. There are 3 steps when it comes to operating the portal. There are 3 things that we need. The first thing when you go in is you fill in the health questionnaire electronically. And then after that, it will take you to the next stage, which is to upload your COVID-19 PCR negative result. And then the third stage is to pay. So if you have reached the second stage and you have uploaded your COVID-19 PCR test, even if you have difficulty paying, there's a button at the top that says generate a QR code. And you can generate a QR code which will say clearly that you haven't paid. You will need to pay before you exit in Nigeria. Preferably pay before boarding, because it will hasten the process of clearing you at the airport. We prefer people paying before they board. It's much, much easier. It takes seconds when you arrive in Nigeria to clear, within minutes. Because if you have the QR code, it's a barcode.
Right.
As you go to the desk, they will just scan it and everything will download, and then they will ask you to exit. If you do not pay before boarding, we will ask you to pay at the airport, which is not only inconvenient, but there will be loads of people trying to do the same thing.
Right.
The QR code at the moment, we've already told the airlines that it is not mandatory, but it is strongly recommended.
Right.
So regardless of whether you have paid or not, you need that QR code, because we want to move from handling paper to electronic copies. And this is not unusual for other countries. We don't want to be handling paper, because if we have a problem with your COVID-19 PCR test, let's say we repeat it at day 7 and it's positive, we need to be able to easily go back electronically and check the COVID-19 PCR test you have online to see whether does it look genuine, where did you have it, whether it's really a true negative or not.
All right.
We cannot do that if they are hard copies and you have thousands of people. So I would really recommend that people go onto the portal and upload the QR code and pay if they can. If they can't pay, we have ways of making sure that they can pay when they arrive. But it's more inconvenient to pass.
Okay. All right. Let me go on a quick break. We'll be right back. Thanks for staying with us. All right, so Nima had a question for our guest.
Yes,
Go ahead, please.
So, good morning,
Dr. Aliyu.
Dr. Aliyu. The NCA this morning were threatening to stop local domestic flights because of non-compliance with the COVID guidelines. What exactly are the issues and how do you plan to mitigate them so that, you know, this area is safe enough?
We continue to work very closely with the aviation authorities, and we completely agree with the NCAA, where you have an agreement with airlines that they need to follow a particular procedure. And I believe most of this relates to the issue of physical distancing and the way you board the flight, and also the issue of wearing face masks within the flight. In general, as you're aware, even within the community, there has been a gradual relaxation by people of the rules. This really shouldn't be happening at this point in time. And certainly for a regulated industry like the airlines, we will not sit down and just accept people to behave the way they want. There has to be repercussions. And as NCAA said, any airline caught flouting the rules will be barred from flying. Right. And we take this very seriously. To a large extent, we are already regulating the international travel side to make sure that the things that we agreed with the international airlines, they abide by. And we intend to do the same thing with the local airlines. They have to travel in a safe manner. They have to make sure that their passengers are safe and are protected from COVID-19.
Right. Dr. Aliyu, let me ask you this question from somebody who just came in from abroad. They said there's a lot of corruption, especially at the airports concerning COVID tests. Many people are paying to just receive a negative result. Wow. Even those who go through the normal portal cannot get their passport back without paying through the back. What are you doing to stop the corruption at the airports? That's a question from somebody who just came in.
Jeez. So to be honest, we are investigating, but so far we haven't really found evidence apart from the very beginning when the Nigerian Immigration Service were able to co-locate some of their staff that were collecting money to release passports illegally. And these staff are already being disciplined. I believe they've already been put aside, and disciplinary action is already being taken against them. At the moment, nobody will take your passport when you arrive at the airport. When you arrive at the airport, regardless of whether you've paid or not, we will take you through the process of payment. If you are unable to pay, you still have 7 days to pay within which to have the test done. We'll allow you to go into town to go and arrange for it to be paid either at a bank or via bank transfer, etc. But you have up to 7 days to pay. Nobody will take your passport. However, if by day 14 you have either not paid or you've paid and you've not had the test done, it will flag up on our system, and we will certainly suspend your passport for 6 months as a penalty for not doing the test. But we do not need your passport in order to suspend it. It's an electronic version, so it can be done. For those that have international passports for those that are non-Nigerians on their way out of the country, if they have not done the test, we will cancel their visas so that they will not even be able to come back in, and they will have difficulty paying for visas in the future. So there are ways for us to enforce the principle of testing and the program we have designed for the purpose of ensuring the safety of our citizens. But as far as corruption is concerned, even yesterday, an issue was raised at the press briefing. And I said, give me the details. I spoke to the lab and I said, they have to do something about this, but give me the details. I'm still waiting for those details. So wherever there are issues, if people can just give us the evidence, we will take action. We will not tolerate corruption of any form when it comes to the COVID-19 pandemic. And certainly money shouldn't be exchanging hands for the purpose of international travel, whether you are paying, etc. We expect all payments to be done electronically. The people that are at the airport, and we have bank officials at the airport, they have their payment methods, but preferably pay before you travel. Yesterday there was a flight that came into Lagos. Only about 5 or 6 people had not paid, had difficulty paying. So the majority of people are able to use the portal. I've had friends, I've had relatives that have come into the country, and whenever I ask them, so what's your experience with the portal now? It's always positive. And as a country, we just have to move to electronic versions for travel. Right. Okay. Even after the COVID pandemic, when we stop the testing, etc., the health questionnaires, if they are needed, they will continue to be electronic. That platform will continue to evolve and will be part of the normal travel platform.
Right.
If we need any additional documentation for traveling, etc., that portal is what we will use. So in a way, it's a step forward for the country. It's easier for us to get the data we need to decide on our policies, etc. But people should please make use of the portal. It is working well now. If there are issues, there are ways for people to get back to us so that we can continue to improve on it.
All right. This QR code, this payment is for the COVID test, Abi?
Yes, it's for the COVID test for people coming into the country.
Yes, for people coming.
So you into the country. That's right. And you choose depending on whether you are in Lagos or Abuja. The Lagos portal has been in existence for quite a while, so we haven't altered it.
Do you specify?
The Abuja portal is.
Do you specify where they're to go for the test after collecting the money, or you specify?
Yes, so
you will go here.
So in fact, you choose the laboratory that you want to go to. So there's a complete choice for the passenger. In Lagos, they have 11 laboratories. In Abuja, we have at the moment 5 laboratories uploaded. We are working on expanding to other cities. But what we agreed with that, particularly with the Abuja laboratories and also the Lagos laboratories, is that wherever you go in the country, if you go to Sokoto, the lab that you have chosen, it's their responsibility to make sure that your sample is collected in Sokoto.
Right.
It's one of the reasons why the charges are slightly higher than what we would have wanted them to be. But in terms of the charges and how much people are paying, PCR tests have always been expensive. The negotiation for the final cost was done with the state government. It's not the responsibility of the PTF. All we do is to ensure that we have a ceiling, that we will not accept the charge to go.
All right, so quickly.
So for Abuja, we have a ceiling, yes.
All right, a Twitter user just said some private universities are charging 25,000 naira per student before resumption on campus for COVID-19 tests, and the government is saying it's free. Do you have an idea why this is happening, sir?
So for the opening of schools, as I said before, we do not recommend testing for the purpose of opening schools. We don't. If private universities are charging for COVID-19 tests, and this is not coming from the PTF, it's not something that we recommend. You test for COVID based on certain indicators. So for instance, if you have symptoms, or if you have been in contact with somebody who has symptoms of COVID, or if you have returned from abroad, or if you belong to a vulnerable group and you're concerned that you might have been exposed, or if you present to a hospital with any of the cardinal signs for COVID. So there are clear indications. When it comes to opening schools, a PCR test is not what is important, because if a PCR test is negative today, it's just giving you a result for that particular period when the sample was taken. The next day, you can be positive. So what is important for the schools is to monitor symptoms. A child coming into school, check his temperature, make sure that they look well. If they have any history of contact, pick them up early, isolate them, and then test them. But testing blindly, it is of no value at all. As I keep on saying, a PCR test that is negative only has significance for that particular moment in time. By the next day or 2 days or 3 days later, that result could change. So are they going to be testing every week? Are they going to be testing students every week? So it doesn't make sense at all. The PTF does not support charging for testing by private schools, whether universities or secondary schools, etc. It has no value. But where there are suspicions, so for instance, we are encouraging schools to make sure that their clinics, especially the boarding schools, their clinics have access to sampling. So if a student presents, for instance, with symptoms to a school clinic, they should be able to isolate the student quickly and take a sample. But otherwise, it doesn't make sense. It's an undue burden on the parents. It's unnecessary. It really
Thank you so much, sir, for joining us this morning. Unfortunately, we have to run out of time. We've been speaking with the National Coordinator for Presidential Task Force on COVID-19, Dr. Sani Aliyu. Let's go on a break. We'll be right back.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GOTV channel 27 and channel 47, StarTimes channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/ live stream.